Dear students, today we'll have a discussion which is more of on-table finding rather operative procedure, but become very popular. A recent one, I can say recent advance, that is just see on-table procedure. What this on-table procedure is. Look at that. See here. See there, you can see the glow here. It's very, very typical. See that? Here also you can see the glow. Somebody is injecting something here. See that? You can see the fiber, some fiber running here. So very, very, very typical thing, that is endovenous laser therapy. So laser, all of you know, there are so many types of laser. NDYAG, neodynamitриum, aluminum garnet, then diode laser, carbon dioxide laser, helium laser. For different places, different lasers are used. In general surgery, we currently what we use is a diode laser, mainly for varicose vein, piles, and so many other areas. So for varicose veins, diode laser 1470 nanometer, nano nm is used actually, and what is got a lengthy laser fiber is there. It glows in the tip, and it gives the firing laser. It gives heat energy there, very high heat energy, so that entire vein gets sclerosed. And of course, we should do it under Doppler guidance, duplex scan Doppler guidance, and so surgeons should know how to do Doppler on table, of course. Then we should inject the saline with tumescent anesthesia, it is called as, because normal saline, soda bicarb, lignocaine will mix up. Sometimes very diluted adrenaline also will last, and you inject that, mainly soda bicarb, normal saline, xylocaine will put, and will inject into the point where you are firing, because it gives the tamponade. It prevents the skin burn, because high heat under the vein. If you don't to inject this normal saline, and it heat will come and cause the skin burn. So prevent the skin burn, and efficacy will be increased. So use a tamponade also. So every 3 millimeter, 3 seconds in each point, you fire. So vein is cannulated, and so slowly it is withdrawn every 3 millimeter for 3 seconds. So joules will come. In the leg, we'll use 8 per second, and go up high up when you go 9, 10, 11 near the thigh. Like that, we will use the joules, numbers. So, and that because of the complete sclerosis of the vein. Of course, it should be you should always add on to the other thing. And main vessels, veins, varicose veins are addressed with that. Small veins are difficult to address. Such patients, we have to do foam sclerotherapy or microsclerotherapy, add on to that. Some bunch of vein perforators, somewhere it is there where laser may not be able to become effective. We may have to do a small stab avulsion also. So often it is a combination procedure. So laser is the prime treatment. Additionally, we may add on to foam sclerotherapy, microfoam therapy, using citral, the sodium tetrahydrosulfate sulfate. We'll use that. It's a very cheap drug. You inject 5 ml air and 0.5 ml or 1 ml dye, and make create a foam and inject into the specific vein after cannulation. It also causes clear sclerosis, and it's a very good method to treat all these things. So that is the basic. So it's a recent one. And the other thing is radio frequency ablation, where temperature is lesser. Similar technique, similar method, similar principles actually. Ablation method actually. So newer technique, it's a recent advance. So that is what is exactly endovenous laser therapy. Otherwise, it is called as EVLT in short form. And remember, it's a short note for you. It is done under duplex scan guidance. I already told, with all aseptic. Of course, you have to do a cleaning and draping. You have to do in operation theatre, not in casualty or some other table which is not sterile. Or entire sterile area is very important. Other sepsis will occur. So entire legs should be cleaned properly, draped with all aseptic precaution in OT table. And sometimes under spinal anesthesia will do local anesthesia, tumescent anesthesia. Tumescent anesthesia is sufficient. So vein is cannulated after marking. Of course, you have to map the vein properly with a venous mapping with a marker. very important. Entire length of the veins, perforators, branches, everything should be mapped properly. Then cannulate the vein usually just above the ankle. Through the cannula, pass a guide wire. Once guide wire reaches adequately, proximal to the SFJ, you should identify it through the Doppler Doppler scan guidance. Then through the guide wire, pass the sheath. Of course, calibrate the sheath and the laser fiber. Because laser fiber should be around 2 centimeter beyond the sheath level. So that you should adjust before only. You got a lock, everything. Then once the sheath is inside as far as your requirement, then remove the guide wire. Then pass the laser through the sheath and tighten the lock there. Then start injecting tumescent anesthesia. Then slowly every 3 millimeter, 3 seconds, fire it until you ablate the vein properly. So complications are ecchymosis, hematoma, bruising, infection. Because if you don't give a tumescent anesthesia, it may cause problem. DVT can occur and pain. So that is that is about EVLA, very commonly asked question when a long case, when you present, and Viva they will ask, MCQs will be asked, 1470 nanometer for MCQ, remember. And you can always go through my manual of surgery, venous disease chapter, where detail of this with the figures are given. Of course, in detail further is given in my operative surgery current edition book in varicose vein. Again, detailed method is also given. So you can always go through that. And so students, answer the MCQ. The modified birthday study done to confirm A. Long saphenous vein varicosity, B. Small saphenous vein varicosity, C. Perforated incompetence, D. Deep vein thrombosis. So please put your right answer. I'll acknowledge you and give the correct answer later, students. And another MCQ is PAMA operation done for A. IVC thrombosis, B. Subclavian vein thrombosis, C. Ilofemoral thrombosis, D. Long saphenous varicose vein. Again, students, put your right answer in the comment box. I acknowledge your right answer and give the right answer later. Please put the right answer. And also request all of you to subscribe my channel, YouTube channel, because it's a free. Everyday lectures are there. It will increase your knowledge about surgery as such. The quotation of the day, remember, know your truth. And it is okay someone else is not believing you, but you should be truthful. You don't require to make everybody to believe your truthfulness. It's not necessary. So it will be natural. So that is the point what this quotation says. So students, please go through my SRB's Manual of Surgery, very popular book all over the world. And my clinical methods in surgery with the video lectures supersedes all other clinical book with the proper information. Everything is covered with the videos, instruments, specimens, basic orthopedic, and also operative surgery briefly. So everything for the clinical side, for CBME syllabus, practical point, it is very, very useful. And my operative surgery, Atlas of Tissue Approximation are very popular books. And please subscribe my website, YouTube, Instagram website for further knowledge and daily regular knowledge. And my digital lectures are there for 220 hours through JP Publishers. For 1 year, you can always purchase and have increase your surgical knowledge, because everything is covered, including your specialties, every general surgery, gastro surgeries, basic operations, instruments, everything as per CBME syllabus for UGs and also for PGs, basic information, it gives everything. Digital lecture for 220 coverage is very, very useful for you. Please, you can purchase through JP Publishers. So please subscribe again requesting my YouTube channel, which is free, SRB Surgical Insight, QR code is here. So students, I hope you have understood my lecture very well. Thank you very much. Again requesting everybody to subscribe my channel to have increase your surgical knowledge as such. Thank you so much.